Hello, everyone. I'm Aarti here, and we have Dr. Murli with us today, who's going to talk about the most sought information topic, which is like precaution of for COVID in children. So we have here Dr. Murli, who is a internal consultant with Apollo Hospital. He's a senior consultant and he's a pediatrician working with Apollo Hospital. He's going to take us through the topic of precautions for COVID in children. He's going to tell us what are the things that we have to do, what precautions we have to take. I would urge patients to put your questions in the chat box so I can forward it to the doctor. Doctor, it's all yours. We are looking forward to hear from you on what are the precautions that we need to take. Thank you
Sure.
so much.
Thanks a lot. Thanks a lot, Aarti.
Yeah.
Good afternoon, everyone. My name is Dr. Murli. I'm one of the pediatric consultant at Apollo Cradle in Karapakam in Chennai. It's a pleasure, like talking to you about one of the common and also like a topic which has been of a lot of interest in the last 3 years because we are now into the third year of pandemic, and this is the pandemic of the 21st century. So I thought I'll just share a PowerPoint presentation, and it's going to just talk about COVID in children, and I will talk through what all is about COVID and what are the treatment options, and how do you go about like managing COVID. And if you have any queries like about COVID with respect to children, you can just post your questions in the chat box. 1 minute, let me just share. Okay. So let's just go back to like when the pandemic started. Like the first case, obviously, all like was like in December 2019. The case was first reported in Wuhan in China, and this was an adult case. And later on, first pediatric case was reported in January 2020, obviously in China. By November 2020, like various parts of the world, started seeing pediatric COVID cases. In the initial few months of like kids presenting with COVID infection, we felt it was more like less severe and not very common in children compared to adults. But later on, as like months went on, with a lot of like testing and a lot of diagnosis being done, it was found like children and adolescents were having severe clinical symptoms, and even some deaths were reported. And as we all know, we are now in the third wave of the COVID in India, and some countries have gone through the fifth wave. And now the current strain of the COVID virus is the Omicron, which I think sure all of you know. And if you look at the total number of cases across the world, and pediatric numbers have been probably underestimated because like for a lot of reasons. One is like it is a we have to do a PCR testing, and a lot of parents don't want the kid to go through a testing because they feel it is very invasive, and a lot of children have very mild symptoms, so thereby they don't have to go in for the testing. So a lot of cases are like underreported, even though the number of cases may be higher than what is currently in the reports at WHO. And this is the graph like showing us the three waves which has been like in India. The first wave was in somewhere around like July of 2020, and then again like we have the Delta wave, which was quite serious. That was the second wave, and you could see like there are a lot of cases reported, and Delta was most like an Indian strain. And currently we are in the third wave, which is the Omicron strain. And as you can see, like the curve is very steep, meaning like a lot of people got infected, and it was a surge was very fast compared to the second wave. And this is the latest data of number of cases across the world through the WHO website, and this was data as per 13th of February. In globally, like there is more than like 4.4 crore and 10,000 10 lakh patients, and deaths been like close to like 58 lakh. And India alone, like there's been like close to like 4.2 crore patients infected, and around 5 lakh people like have died from COVID. And with regards to number of pediatric cases, this was like last data was from September 2021. So we can see like most like almost like if you compare with the adult population with the COVID infection, under 5 like almost represented like 1.8%. That is closely around like like 16 lakh children, and of which like less than 0.1%, like have died from the COVID. And going on to 5 to 14 years, it's almost 6.3% of the adult cases. And again, number of mortality or the death has been around 0.1%. And as the child got into adolescent and like an early adult, the cases were like around 14.5% compared to the adult population, and death was slightly more compared to the younger children. So this has been the statistical data what we got from September 2021. And so going on to the SARS-CoV-2, that is your coronavirus. This has been a common, like one of the respiratory viruses which has been there with us for a long time. And this new strain is from the Wuhan strain. Obviously, it's called SARS-CoV-2. That's a virus which has been enough which has caused the third pandemic. And spread is predominantly by droplet. When I say droplet, it means like when a patient was infected coughs or sneezes or talks or even sings, the salivary particles or like things which comes through the mouth, it is suspended in the air, and person who breathes it or like who touch and like they by mistake they may transfer the virus into the mucosal surface like your nose, your mouth or eyes. So that is why it is always been told like like make sure whenever going to a crowded place or something, when you touch surfaces, try to keep your hands clean and try not to touch your face, especially your eyes, nose and mouth, because that is a route of entry of the virus. And the infectivity has been varying between the different strains, and especially the current Omicron variant, the infectivity rate is very high. So like the rate of transfer from one patient to the other is very high. That is why I've seen a steep increase in cases very fast. And so far we had close to 5 major variants like alpha, beta, gamma. Delta was mainly originated from India, and now the Omicron. And most initially we thought like most children are not infected, but in fact like most source of infection in children is usually from parents, that is meaning adults, and they or someone who's been outside the family, the child has been in a contact with them, or unknown contacts. You go to a public place, the child may get exposed to the virus from someone else. And children are not the primary source of infection in most cases. And evidence suggests like children, especially the school age children, are far susceptible to the infection. And like are initially we thought they're going to spread the virus, like because they have a lot of contact with the elderly people and like adults in the family, the chance of spreading is very high. But it's not the case. And even newborn babies can get the virus from the mother. If mother is COVID positive, there is a chance that the baby may pick the virus from the mother, or even it can, even during the pregnancy itself, it can be pleasantly, it can be transferred. And the disease severity is depending on the age. The younger you are and the elder you are, the disease severity is much higher. And it has been shown like the transmission is much higher in children between the age of 0 to 14 years and elderly population. So what are the common symptoms of the COVID infection? So I'll just go on. One of the commonest symptoms of COVID is fever, and they can have dry cough and tiredness. This is one of the common things we see in day-to-day practice. And a lot of other symptoms are also present with the COVID infection. One is sore throat, and off late we are seeing a lot of children with headache and nose block and nausea, vomiting. Sometimes they have diarrhea. And other common things are like the kids will complain of a lot of body pain, like limb pains, and especially small infants and toddlers. They'll have a lot of irritability because they can't express a pain, so they tend to be very irritable. And other thing we have seen commonly in this sort of the third wave is a lot of kids with abdominal pain. And obviously the older children and adults, they sometimes will complain about loss of taste and smell. And some people have congested eyes and different types of skin rashes. These are all quite common symptoms in the COVID infection. So what are the symptoms of a severe COVID is? Because the disease severity can be from mild to moderate to severe. In case of severe COVID disease, they can have a lot of respiratory infection that causes shortness of breath, and it can affect other organs too. Like so, they can get confusion and like have chest pain, high degree fevers, and they can also have some involvement of the brain, which causes like reduced consciousness or drowsiness, and rarely they can cause seizures. And in adults, there have been reports of sleep disorders, and also like there's been reports of stroke and inflammation of the brain, nerve damages and confusion states. And this is one of the dreaded complication of the COVID infection. As I said, majority of children with COVID infection, like when they have acute infection, they just have a very mild symptom, like which lasts for around 3 to 5 days, with fevers, sore throat, body pain, cough, and most of them recover without any, hospitalization or a lot of medication. One thing which happens in some children with COVID infection, after a few weeks of infection and recovery, they develop a syndrome called multi-system inflammatory syndrome in children. This is called MISI. So this is basically inflammation of different body parts, which can affect the lungs, your heart, your kidney, your brain, skin, eyes, and your intestinal tract. So these are the common things you have to be aware of, because a lot of children, as I said, in the last 2.5, like 2.5 years, we've seen a lot of children with COVID infection, and very rarely we have seen cases with this presentation where the child would have been treated for some other infection, because the child comes in with fever for 4 or 5 days with mild red eyes. Initially it was thought something else, and after a lot of case reports, this condition has been you know well described in pediatric age group, and this can be sometimes life threatening and requires prompt treatment, and also sometimes a tertiary care for this condition. So one of the commonest things should be fever. So the child normally will present with fever. Plus, they may have other symptoms like stomach pain. The eyes can be very red and congested. They can have diarrhea. They can feel very dizzy and lightedness, just showing this could be a sign of low blood pressure. And they'll present with skin rashes. Sometimes they can have lymph nodes, meaning the swelling in the neck, and vomiting. And it's very important to recognize this syndrome, because if we delay, it can affect the vital organs, and that can cause long term damage and even death in children. And so it is very, very important, like you're aware of this complication, which usually happens anywhere from 2 weeks to up to 4 to 5 months after the recovery from COVID infection. So just please be aware of this condition. As I said, there's one thing which I keep stressing on the COVID, consultations we have, to the parents, because most of the kids will recover, say, within 3 to 5 days. They don't have much problem, and most even don't even have symptoms, so they have very asymptomatic. But this thing can happen to anyone with a past COVID infection, and doesn't happen immediately. It happens after a few weeks after recovery from the initial infection. So it is very important to be aware of this condition. So how do you go about finding out what this, like, obviously the things is contact. Like, for example, if a parent is symptomatic, then obviously, or COVID positive, then we start suspecting in the spread of COVID virus if other family members are getting symptoms. That's what we're seeing in this last 2.5 years. One of the adult family members will have symptoms, and within few days, the other members will get infected, especially children. And obviously, the testing. Initially, we were not doing so many PCR testing, but in the last 1.5 years or so, like, we are doing more PCR testing, and now even rapid antigen test has been approved to be used at home. So that is also increase the number of detection. So the main testing is COVID RT-PCR. And as I said, recently we started doing the rapid antigen test. And again, one like note of caution is rapid antigen test can be less accurate. It's more for a screening tool. Another thing is, a lot of patients who do the antigen tests, they don't report. So this also reduces the number of cases being reported across India, because this RT-PCR, anyone who's positive, the data goes to the ICMR. So that is all getting into the statistics of number of cases per, in the country. And the other thing is a blood test. That we can do a blood test to see whether the patient has had a past COVID infection. So that is an antibody test. And as I said, like, we don't routinely do blood testing in a straightforward COVID infection, because a lot of children will have very mild symptoms, and even like in adolescents, only if they have very high grade fever or other system involvement, then they may require further investigation that involves blood tests and other investigations like X-rays. Sort of, they can even go for ultrasound scan of the abdomen, echocardiogram, depending on the one I told you earlier, like the MISI. That is usually which happens after few weeks after the initial COVID infection. So it's important to know about isolation, because a lot of us, like with COVID infection the last 2.5 years, like, we all hear about isolation and quarantine. So this is something which has been recommended by the WHO. So if a person is PCR positive but doesn't have any symptoms, so what you do is you take day one. The day one is on the day of PCR testing as day one. So you isolate yourself from other family members and watch it for symptoms. If you don't have a symptom in the next 10 days, it means probably you have not got the infection. So you have the infection, but like the symptoms are not come. The virus has been there, but you're not developing symptoms, so the chance of you spreading the virus is less. So you can come out of isolation on day 11. In case you're COVID positive, that is means you're symptomatic, then you isolate yourself for 10 days, and you take 3 days plus, meaning that the 3 days should be without symptoms. You carry on isolation until you're asymptomatic for 3 days. And if you don't have any symptoms for like 10 plus the what we call 3 days, then you can come out of isolation. So usually we say like quarantine for at least 14 days. Now the current things have changed. Like they say if you are double vaccinated, you can like be in isolation for 7 days, and then you can come out of isolation. And another thing is, like in newborns, like COVID and breastfeeding is one of the common things we see. Like when mothers, like they're breastfeeding mothers, when they become COVID positive, there are a lot of anxiety about whether the baby will get the infection. And a lot of data is there to say that there is no spread of virus through the breast milk, and this has been well proved beyond doubt. And COVID mothers should continue to breastfeed depending on how well they are. If mother is obviously very sick and is not able to breastfeed, then we have to look at other options. And we always advise mothers, who are COVID positive, to wear a mask appropriately, and then make sure the hands are washed properly, and try to be with the baby as like during feeds, and like try to reduce contact as much as possible. But obviously in the newborn babies, baby has to be fed very regularly. So make sure the mother is wearing a mask and follow good hand hygiene. So there is no problem of mother like who's COVID positive in breastfeeding the baby. So what are the treatment options? Like obviously a lot of children who come in with COVID, they have very mild symptoms. So what we normally advise is supportive care, meaning we don't have to give a lot of medication. So we ensure the child is well hydrated, and for the fever, we generally advise use of paracetamol. And if required, we can also add on a non-steroidal anti-inflammatory drug like brufen or mefenamic acid, especially for the fevers. And it's very important that children are given very healthy food, including all fruits, unless there is a specific reason why the child should not eat a particular food. So there is no diet restriction during an acute COVID infection. It's always like advisable to give like protein rich diet and a lot of fluids. And one of the other thing we see is antibiotic prescription. Like a lot of patients with COVID infection are given antibiotics. As you know, the COVID is a viral infection, so there is no role for antibiotics because antibiotics works only for a bacteria, so it doesn't work in a viral infection. So unless it is required and prescribed by a doctor, try avoid taking antibiotics. Antibiotics mainly for probably treating a secondary infection after an initial COVID infection, because some patients may get a secondary infection that may require antibiotics. So that should be done only by a doctor. And try and avoid over-the-counter, self-medication. And especially, like there was time when people used to take steroids, like which was like used in the treatment initial in the initial waves. But now we strongly advise not to take any self-medication. And obviously, when would you bring a child into hospital? If obviously the child has got very high grade fever for more than 3 to 5 days, dehydration is there, or the child is having severe cough with breathing difficulties and low oxygen level. So these are things which will prompt the child to be brought to the hospital, and the child most likely may need some supportive care and may require further investigation. Another thing I touched upon earlier about is the MISI, that inflammatory syndrome. This again, like when a child presents to you with like fever with other symptoms I just told you, the child is having like a red eyes and sorry, sorry. So these are things the child like needs to be hospital. Sorry, 1 second. Okay, so I think I've just like I just want to briefly present the common things which we see in the pediatric COVIDs, and I would probably like want to like answer your questions. If there's anything there, like just please let me know. I'll be able to answer your questions.
Sir, we have certain questions I have sent you in the chat, sir.
Sure, yeah. Thank you. So the first question is what nutrition diet should they have to increase immunity and avoid COVID? So obviously there's been a lot of discussion about giving multivitamins and vitamin D and all the things in the initial days when the first COVID first started. There used to be practice of giving vitamin C, zinc, vitamin D. Off late, it has been shown like giving vitamin supplements during acute infection doesn't make a lot of difference. It is important like to keep the immunity up by giving these vitamins early. And again, be careful about like certain vitamins which can't be given, like for example vitamin D. You can't just give high dose vitamin D without knowing the actual vitamin D level for the patient. So it is important to give very nutritious food. I mean, like the child can take pretty much all healthy foods, like all fruits, your millets, pulses, all green leafy vegetables. So basically there's no diet restriction as long as the child is taking a healthy diet. And if you can give multivitamins, and as I said before, multivitamin may help the immunity but doesn't stop you from getting an infection. So next question is, what kind of conversation should a parent have with children during COVID period? So if I understand this question right, I think like a lot of children, as I said, initial days they had a lot of fear about the COVID infection because they used to see a lot of news, and like the whole world changed upside down after the pandemic started, because kids were not allowed to play outside, they're not allowed to go to school, and even within the family members they're not allowed to visit other family members because of all these lockdowns and a lot of concerns. So like it's important, like we do see some adolescent, who like I had a child who was known diabetic, had a COVID infection. So there was a lot of like anxiety in the child as well, like she was very concerned whether she's going to end up in ICU. And so this is very important, like to counsel them and explain to them, like in COVID, in most children are mild and they can be managed. So it is important to have positive reinforcement, like let's not think about COVID as something very serious, but in some cases it is. So it is important to like engage with children and tell them, like this is manageable. So the next question is, how much should you keep disinfecting things to avoid spread? And exactly, like it's very important, like especially if within the house, if there's anyone with COVID infection, we say you just isolate yourself in a separate room and avoid contact with asymptomatic or other family members who are not having an infection or symptoms. So it is important to like disinfect the surfaces, like just disinfect with the bleach, and like even alcohol, like isopropyl alcohol can be used to wipe clean the surfaces. And there was a lot of concerns about food and vegetables. People used to like keep it out in the sun for a day or two, and turmeric and a lot of things was done. This is all not required, because anything which is cooked, you kill the virus. So make sure to follow the hygiene, and obviously hand washing, and like cleaning the surfaces, and this should be more than enough. And take the three mantras, like physical distancing, hand washing, and face masking. This is very important, like you have social distancing, and masking is very important, and obviously the hand hygiene is very, very important. So what are the after effects seen in children after they get infected? As I said before, most children who have an acute COVID infection, they get through without major problems. Like there are some children who have the issues I just early touched on. There is one thing is called the MISI, that is your acute inflammatory syndrome, which can be quite nasty in certain children who end up in ICU, and they can have other organ damage. And obviously psychological, there are some children who have a lot of issues with having depression. Like as I said, some case reports of sleep disorders have been described in children too. And depending on the severity, like so there are children who have severe pneumonia, and they can have lung infection which causes lung mobility. That is, child may require a bit of oxygen, or they may get a bit breathless with activities, and which over a period of time improves. So what should parent look for or be careful post COVID infection of the child? So I think it's important, as is, like as we discussed before, about like watching out for the symptoms of the MISI, that is your inflammatory syndrome. That is, say for example, after the child recovers from acute infection, immediately just make sure that nutrition is good. Make sure, because child would have like had a fever for a few days and would have not had food properly, so they would have even lost some weight. And it is very important that they get back the nutrition by giving proper food. that is like immediately after the recovery. And other thing is make sure you watch it for the other complication which we talked earlier about, the MISI, that is your inflammatory syndrome, because that is one of the common, the most what I would say, like uh, rare complication, but it can cause a lot of damage to the child's organs. So that is why like everyone worries about the post-COVID syndrome. Because most acute infections, like most children recover, and most kids are even asymptomatic, but some children may get into this complication of MISI. Does wearing the mask for a long time pose any risk to my child? That's a good question, and I think a lot of parents are worried about wearing a mask. The child may get breathless. Carbon dioxide will increase. Your oxygen level will drop. This has all been proven. Like it doesn't really happen. So because there are a lot of studies being done, and wearing a mask will not affect your oxygen level, and it will not obviously cause any other problem. And make sure that you wear a mask at the right place in the right time. Like it's important, like like obviously if you're going for a long jogging, with not much people around, you can like have to be a little like thinking about, you can jog without a mask. But if you're obviously in a crowded place, or there are a lot of people nearby, it is very important that you wear a mask. So as long as you wear an appropriate mask, it shouldn't be a problem. And most children, like they do wear a mask, but it's important to teach them how to wear a mask correctly, because I see a lot of like patients, they'll wear a mask, but the mask is like well below the nose or in the chin level, and the child's mask is too loose, because sometimes it has to be snugly fitting. Because if you don't wear the mask correctly, the virus can go through, because like there are a lot of leaks. So make sure the mask is worn correctly. And it's important to just tell the children not to keep adjusting the mask very frequently, because it because it's not something nice to wear a mask and like do a lot of activities and things. Like, so the kids will, what they do, they keep touching the mask frequently, especially if they're playing in a group. Like some children may wear a mask, may not wear a mask, and there's always chance that virus may be sticking to the front of your mask. And it is important, like, you don't touch the front of the mask. So you just have to keep telling children, like, how to wear a mask correctly. And like, make sure the hand hygiene has been taught. Can my child participate in physical activity after isolation? I think it's very important. Like, I think child can, after the children have, gone through the acute infection and then done full like quarantine, and they remain asymptomatic, they can like start doing normal physical activities. It all depends on how sick the child was. Like a lot of children, if they have mild symptoms, they would like just get back to normal activities even during the illness, even during the quarantine time. They'll be very active without any problem. But some children may have like very high fevers, would have had like respiratory infection, which would cause some sort of oxygen requirement or some medication. They may require a little bit more time for recovery. So as per the child's condition, you can let them do the normal physical activities. So you just have to like watch them, like just see whether they're able to cope with activities, and encourage them to do the normal physical activities. So I think like, as we just like went through the talk, so COVID infection is like, it's still there, it is not gone. And there are a lot of discussions about like, we're saying like, the third wave will be the end of COVID. And like, I think it's not. I think probably we shouldn't think that way, because COVID is still a threat to everyone. Like, even though like like vaccine rates are increasing, and obviously this so-called Omicron variant has been a little kind to us, say like, it's caused a very mild disease. But still, like, we never know what the next strain is going to be. So that is why even the WHO is cautioning everyone, like, not to take the COVID lightly, because we are just in the third wave. So we don't know when the next wave is going to come and what the next strain is going to be. Is it going to be more virulent and cause more serious infections or disease process? We still don't know. So I think it's very important, like, we still take all the precautionary measures. As I said before, children get the infection mainly from adults. So I think it is very important for adults to be a little careful, especially if you have children. And for the sake of a society, it's important that we still take the precautionary measures. Even though like you may have taken the vaccination, you may have very mild symptoms. So it doesn't mean like you don't get the virus, because the vaccine effect will be there protective for some months. It's not going to be indefinite. So at one point you may get the infection, and you may spread the infection to the other members of the family or the people in the community. So I think it's still important that we continue to take all the COVID precautions. I think there's any more questions. So I think thank you for your patient listening and participating. And I hope I have answered your queries. And it's been a pleasure talking to you. Um, Thanks a lot.
Thank you so much, sir. It was quite informative and we get a lot of information. Thank you so much. And thanks to the viewers as well. I'll conclude the session. Thank you.